Okay, hi everyone. I am here with Chris Myers, who runs Complete Physio and also Smug. And we're just going to talk through basically buying a diagnostic ultrasound system. How do you justify it? Is it a good move or is it not? So, Chris, starting off, you run a successful practice in London. You've got several bits of technology. Diagnostic ultrasound plays a big part in that. How have you justified those investments?
Yeah, so I think we've got 5 or 6 machines within the clinic. There's probably about 5 or 6 of us now that have completed our postgraduate certificate, and I think very much the philosophy in Complete Physio is that we believe that if you get the right diagnosis, and we do mean a specific diagnosis at the beginning of your treatment program, you're more likely to get the sort of optimal management. So we like to start with a really good specific diagnosis. The only way of doing that is a really good clinical assessment, in my opinion, but combined with an ultrasound scan. And obviously we're talking about peripheral joints here. Some of us also, so 3 of us, actually almost 4 of us now, carry out ultrasound guided injections. So we do steroid injections, and we mainly do steroid injections and hyaluronic acid injections and some high volume techniques as well. So although we don't have a specific charge for an ultrasound scan, we do carry out ultrasound guided injections. We charge £230, which is a very competitive price. And we do lots of guided injections. So from a return on investment point of view, we can justify that through having the greater fee for carrying out guided injections.
Okay, so you mentioned that you don't charge a specific fee. Is there a particular reason why you don't do that? You invested a lot of money in these, so how do you?
Yeah, we get that question a lot actually on our courses and emails in, and so I think that it's not a straightforward answer, Andy, but I'll try and waffle my way through it. So the first thing is that if a patient walks into me with a shoulder problem, for example, and it's not a frozen shoulder or an AC joint, which is, I totally understand, is a clinical diagnosis, our clinical assessment is actually quite limited if you're after a specific structural diagnosis. And therefore, if a shoulder patient comes in, I want to do an ultrasound scan because I want more information than what I can get from a clinical assessment. And I believe, and you can argue this both ways. I've been a physio for over 20 years. I'm fully aware of what the sort of negative impact of over imaging can be. But for me, I want to carry out an ultrasound scan, get structural diagnosis. And I believe that's what the patient wants. And I believe that gaining that extra level of information, which is all you're doing with an ultrasound scan, can help me to improve patient satisfaction, get more out of my assessment, and hopefully in the end put a patient onto the correct management program as soon as possible. I don't want to be in a position where I carry out a clinical assessment and I say to a patient, well, for another 50 quid, I could get this machine that's sitting in the corner of my room and carry out an ultrasound scan. That for me, that just is not how I want to work. And for those that are used to using diagnostic ultrasound, if you've got a shoulder problem, if you've got an ankle sprain, you want that extra level of information. So I don't want to be in a position where I'm asking a patient for more money for a scan. So the way we get around it is the guys that scan have a greater fee. So we basically incorporate an ultrasound scan into our initial assessment fee. Now it could be, Andy, that you've got a back problem, and obviously ultrasound is no good for backs, but my fee is still the same. So really it is for my clinical expertise, which may or may not incorporate an ultrasound scan itself. For about 6 years, we didn't even have a greater fee. But if you're trying to justify, adding that extra layer and that extra information to your clinical assessment, and you want to do an ultrasound scan, then one way of justifying that spend is increasing your initial assessment fee. But I wouldn't advertise yourselves or advertise a separate fee for an ultrasound scan. The other thing I always say to people is we're not offering an ultrasound clinic service. We're offering a physiotherapist assessment that happens to include a diagnostic ultrasound scan. If you start advertising on your clinic, ultrasound clinic service, you're going to get all sorts booking in. You're going to get, the main thing you're going to get is lumps and bumps. And for anybody that's done a PG cert, has scanned with musculoskeletal radiologists, you know that on a musculoskeletal list in the NHS, you get a lot of lumps and bumps. And as a physiotherapist who scans, my rule is I do not scan lumps and bumps. I don't know a lot about them. I'm not competent within it. And therefore, I don't want to be encouraging those things into my clinic. There are other things to consider, and I mentioned this in the blog that I've recently written, is that actually if you are offering an ultrasound clinic service, even if you've done a postgraduate certificate in musculoskeletal ultrasound like myself, you still need the correct policies, the correct procedures around that. So first of all, you will need to work out of a premises that has CQC, and secondly, you'll have to have a pack storage system like they have in hospitals, or something equivalent where you can store that scan and provide that scan information to the patient if they ask for it. So there's quite a lot of setup around that in itself. So I personally don't have any interest in setting up an ultrasound clinic service. However, I do get lots of patients that come and see me because they know I combine an assessment with an ultrasound as well.
So would that be something if a patient did phone up, would they be told that by whoever's answering your phone?
Yeah, and that's actually, for somebody that runs private practice, our receptionists get lots of questions because we obviously do say that we do diagnostic ultrasound. And so you do end up doing sort of screening emails, ringing patients. And it might be that, you know, for example, if it is a back patient or a neck patient, they don't necessarily have to come and see me. I've got really experienced physios that don't scan, have no interest in scanning, and would see more neck patients, more back patients, something like that. So you've got to have a good reception system to try and funnel some of this information.
And in terms of that then, so how do you think it's helped grow your business? Like, how much of a difference has that made to you being able to offer this integrated service with that?
Yeah, I mean, look, I'm massively biased. I've scanned for 10 years. I run an ultrasound training company, but I do not want to do my job without diagnostic ultrasound. Even if you just take patient pathway out of it, just purely from an enjoyment point of view. But there is no doubt, in my opinion, that one of the reasons Complete Physio is, you know, going well is because we have diagnostic ultrasound in the clinic. And if I was a patient and I had a choice to go and see a physiotherapist down the road or go and see one of my guys or myself, and I knew I was going to get that ultrasound scan, for example, if it was an Achilles or something like that, I think just at face value, it makes perfect sense to a patient that you're actually looking inside the body, and it does take away some of that guesswork. And that's not just through my own opinion. I hear that from patients all the time. They like to tell me why they come to the clinic. And a lot of it is because we have integrated diagnostic ultrasound into what we do.
And for the people that work for you then, how experienced are they with ultrasound, and what are the basic requirements you would say?
So again, I suppose, you know, that I teach lots of physios that scan. For us, nobody scans in our clinic if they don't have a postgraduate certificate or equivalent training pathway. So we do a SMUG mentorship program, and that is what I would call an equivalent training pathway. It's certainly a great way of ensuring that they have the correct standards. But we've got to remember, you know, all of our guys have done postgraduate certificates, and they'll be the first to admit that you come out of that, just like you come out of physio school, you come out with the basic knowledge, you're safe to scan, but you're learning all the time in diagnostic ultrasound. So I would encourage anybody that is learning diagnostic ultrasound to try and do a postgraduate certificate or equivalent sort of learning pathway. And if you can't do that, or you don't want to do that, because there is currently no set out guidelines saying what you do have to do and what you don't have to do, but I would suggest what you do need to be doing is logging lots and lots of scans, and having a portfolio of practice. So if somebody does want to say, well, why are you doing this? Where's your competency in this? That you can provide that logbook of, say, 150 to 200, 250 scans. So it's a very long learning pathway. It's an expensive, we talked about this earlier, and it's an expensive learning pathway. Not only do you need to buy a machine, but you have to put in the training into your budget as well. There's no point having a machine and not putting in essentially the thousands of pounds it takes to get good at ultrasound. You know, this isn't shockwave. This isn't buy a machine and essentially you can get started and you can start getting your return investment straight away. This is something that takes time, and you do not go into diagnostic ultrasound to make money. You do it to further your career, improve your diagnosis. And yeah, don't get me wrong, at some point, particularly if you add guided injections into it, there is a new revenue stream there. But you do it because you feel this is the way that you want to work. And you can't put that into a spreadsheet when you're justifying the spend. It's just the way you want to work. You want more information. You want to keep motivated in your career. You know, I feel that a big part of me still being motivated after 20 whatever years is because I've incorporated diagnostic ultrasound into what I do. You know, I'm really, one of the reasons I went into physio, and lots of people do, is because I loved anatomy. I love the way the body moves. I'm interested in the way the body moves. And what's better than looking underneath the skin and actually seeing how something moves? You know, it's pretty awesome, to be honest.
So at what point then would you suggest that someone just straight out of university, at what point do you think they should engage with this?
That's a really good question, Andy. When you first come out of university, you know very little. And if you think you know a lot, then that's the worst sort of physio you can have, because there's so much to learn. I think it's really important that you probably spend 3 to 5 years really developing your skills, developing your clinical reasoning, and then adding ultrasound in at some point when you are working in the environment where it's going to be encouraged, where it's going to be supported, and when you've got some cash to buy a machine and actually get yourself through some sort of training pathway.
Yeah, no, that's a good one.
What I would say, Andy, on that is, at the same time, I wish I'd learned anatomy off an ultrasound, because it doesn't look like it does in the books. The bursa is a great example of that, and muscles and tendons and musculotendinous units that, you know, it would be great to have learned anatomy off ultrasound. So it would be good to be exposed to it a little bit earlier on, but I personally don't feel that having a diagnostic ultrasound scan in the hands of somebody 2 weeks qualified is the right way of doing it. So I would encourage young physios to really get the experience, the clinical reasoning side of things before you incorporate diagnostic ultrasound.
So if you get yourself in a practice or a clinic where they've got access to it with maybe more experienced personnel, that would be a perfect scenario.
Absolutely, or ideally working in the NHS, which is where I was working when I learned diagnostic ultrasound, where you're in a really supportive, protected environment. Once you get out into private practice, that's not a supported and that's not a protected environment. You need to make sure that you've got everything in place from a policies point of view, and that you've got the right training to prove your competency.
Okay, yeah, and in terms of competency then, like, how good does the machine need to be? Like, there's various different systems.
Yeah, I've written quite a few blogs on this recently, and again, it's not a straightforward answer, but I'll try and make it straightforward. The better machine you have, generally the more money you've had to spend, and the easier it is for you to learn diagnostic ultrasound. So when you first get started, you don't want a rubbish, although when you first get started, you're trying to buy a machine for not a lot of money, because you want to get started because it's exciting, and you know it, but at the same time, if you buy a machine that isn't, I don't know, is not a lot of money and doesn't have a good image quality, you're soon going to grow out of it, and you're going to make it doubly hard for yourself at the beginning, because you can't scan very well at the beginning. You don't really know what each grey actually means, and you've got a rubbish machine. So ideally, although it's a lot to invest in, I would strongly recommend that you spend as much money as you can. And I do mean 10 to 15 grand ideally, because I do believe that if you spend that money now, so you've got to be sure that this is for you. If you spend that money, you won't be looking for a new machine in 3 years. You know, after 5 years, a 10 to 15,000 pound machine should still do the job. But if you buy a cheaper machine, a second-hand machine with no warranty, or a machine for around 5-7 grand, you know, unless you just get a great deal, which often aren't out there, I don't think that, I think you would end up regretting that. Certainly we get people on our courses, they walk in with certain machines and I think they regret it quite quickly when they start scanning on the machines that we have on the courses. But that's a hard thing to swallow, and it's a hard thing to spend your money on. And that's why I wrote this blog that, you know, which sort of is where this has come from, is that you really need to be aware of the time commitment and the financial commitment.
Yeah, I mean, you've touched on this a lot, so I want to ask the question anyway, though. If you've got a limited budget of, as everyone does to some extent, why would you not buy, say, a therapeutic device that you can see has a direct impact with that patient and they can feel the difference, as opposed to buying something that's purely just helping with the diagnosis?
Yeah, that's you know. So I suppose, you know, coming back to, say, buying a shockwave machine or buying something that is, as you say, a treatment modality, rather than something that maybe is slightly harder to justify from a return on investment point of view. So for me, it's a really easy question to answer, Andy. Probably the easiest one so far is, for me, the correct diagnosis is the most important thing in the patient pathway. And if you think you always get the correct diagnosis, then I can assure you that you're wrong. And just because a patient gets better with a treatment doesn't mean you've started with the correct diagnosis. But for me, if you get the correct diagnosis, then everything else sort of fits in nicely after. So I would always invest in that initial stage rather than the end stage from a personal point of view, because I think the end stage, to a certain extent, takes care of itself, although it's not that straightforward, I appreciate, if you start with a good diagnosis.
So do you think that we can see that in MSK, the massive shift towards using this, but it's still quite an early stage. How far do you think it will go? Like, what percentage of clinics do you see it having a system?
That's a good question. And I've been doing it for over 10 years, and don't get me wrong, more and more people are using it. Okay, more and more people, and if there's more and more people using it, there's more and more people using it not badly, unfortunately, because and that worries me. There's a lack of pathways. The CSP haven't really come forward with anything yet in terms of what the minimal level of requirement is. That would be really useful. So yeah, sorry, what was the question, Andy?
So it's basically like, what percentage? How far do you think it's going?
Oh yeah, sorry, Andy. Yeah, so I think more and more people will start using ultrasound. I'd love it to be more more controlled, as I said, and I suggest that if people are going to buy a machine and go down the route, that they really think carefully about their investment and the timing investment. I think at face value, it's a no-brainer, being a physiotherapist, having an ultrasound machine in the room. I think most people can see that. I think, you know, we know that if you add ultrasound to a clinical assessment, patients are happy with it. So yeah, I can see it getting more and more popular, which is a really good thing from somebody that teaches it and somebody that's passionate about it. But I do think this needs regulating a lot more than it is at the moment. Essentially, anybody can go out and buy a machine, and anybody can start using it in their clinic. Ultrasound is a dangerous modality in the wrong hands. You know, we pick up things all the time that we don't expect to see. We think we've nailed that clinical diagnosis. You put the probe on, and within about 10 seconds, you've changed your diagnosis. So for somebody that is very passionate about diagnostic ultrasound, I think every physio that is interested and wants to focus on diagnosis, then I think they should be using it, but using an accredited or at least a formal learning pathway.
So would you suggest doing that before they even invest in a machine, or what comes first?
It depends. If you're somebody that's been exposed to it just by watching other people, like somebody in my clinic that's watched me, I think they know where it fits in. Do you know what I mean? We have a situation in our clinic where if one of our physios has got a shoulder patient that's not getting better, I'll literally reel them into my room for 5 minutes to get a bit more information about the cuff or something like that. The other thing that I've mentioned to people before, but I think it's really important, is if you're going to commit to diagnostic ultrasound from a money point of view, from a time point of view, you have to understand that other parts of your practice will have less attention. So I've gone down the diagnostic ultrasound route, ultrasound guided injection route. You know, I'm seeing less neck pain, less back pain. I'm doing less back rehab. I can't remember the last time. Well, I can, but I don't do as many ACL rehabs as I used to do. So you do actually downskill, I believe, in other areas. So you've got to make sure that this is the route that you want to go, because as a physio, you can't do everything. In my practice, I've got people like myself that love the diagnostic side of it. You know, I appreciate that there's a role for ultrasound guided injections and I enjoy doing them. But I've got physios like, no, that's for you, Chris. I really like rehabbing backs. That's my thing. And you can't do everything. And that's why it's great that we work in a team where we've got all those different skill sets. So I suppose what I'm saying is, if you are going to go down the diagnostic ultrasound route, then just be aware that if you're also doing a master's in sports medicine at the same time, or you're trying to develop a certain back pathway, you can't do everything, and there's only so many hours in the day.
Yeah.
Does that make sense?
No, it does, definitely. Yeah, you want to specialize in a certain area and commit to it. And that's another thing, though, is when you look at that, there's obviously the system to buy, but then you look at the vast array of probes that you can use.
Yeah.
What would you suggest? How many do you need?
Yeah, that's a good question. And when people are about to buy a machine, they quite often ask me that. And it comes down to what you're going to use it for. If you're going to be a general MSK sort of sonographer, so you're going to be scanning shoulders, knees, hips, then you need I use a 5 to 12 megahertz probe. And that's pretty much, I could do everything I need to do with that one probe. You don't need a hockey stick probe, and you don't need a convex probe. So one probe, I've got a few more probes now, but for 8 years in private practice, I had one probe. So, however, if you're a rheumatologist, you do lots of hands and feet, then yeah, maybe you do need a hockey stick probe. Or if you do lots of deep hip injections, you may need a convex probe. Excuse me, but essentially most of what we do in a general physio practice can be done with one probe, one linear probe, 3 to 15, 5 to 15, 3 to 12, 5 to 12 megahertz.
Okay, that's great.
The frequency of the probe is really important, but the frequency of probe is not the only important thing. It's all very well have a very high frequency probe, but you need to have a really good processing system behind it. So it's not just the probe and the frequency, it's also the system itself.
Yeah. And just talking about that then, so in your practice, you've got men and women's health that you do some work with. So do you bring in the ultrasound into that? Like, is that a business decision, or do you just see that that's going to add value in that area? Yeah,
so we don't currently, so Claire, our main women's health physio, she doesn't currently use diagnostic ultrasound, but it is something that we'll be encouraging her into, because we've got the machines there. You know, in my opinion, it may as well be used and utilized as much as possible to justify, spending the money.
Yeah. I know we were talking about 3 and 4D baby scanning, but maybe that's a talk for another day.
Not for me, Andy. Not for me.
Yeah. No, great. I mean, that's really covered pretty much everything that I wanted to go through. I mean, the one question I would say as well is, and this is a question that we get asked a lot, is what do we do? I'm interested in diagnostic ultrasound. What I tend to do is I say, speak to you.
Yeah.
But like, is there anything else that you would suggest?
Yeah. So I suppose I probably covered the main points, which is to take your time, think about, is this the direction you want to go? Spend some time with people doing diagnostic ultrasound. You know, have a look on our website, www.ultrasoundtraining.co.uk, and you go to the resources. I've done, and you've seen quite a few of them, Andy. I've done 10 to 15 blog articles, which I think are really useful, and I've written them on the back of speaking to probably thousands of physios and sports docs that want to get started. So it's really important to have a read through about competency, about training, about what machine to buy. But I'd suggest that you try and spend some time with people that scan, start to understand how ultrasound fits into the overall clinical assessment. And then some people I speak to, they just want to come on our 2-day introduction, because although, these courses are not cheap, it's a lot cheaper than buying a machine for £8,000 that you don't use and you don't understand actually what the learning commitment is to getting there. So it can be money well spent, even if you think actually this isn't something that I can commit the time to at the moment. But it also gives you an awful lot of anatomical and clinical reasoning in the courses, which you can find useful anyway, even if you don't go on and actually scan.
Great. Yeah. No. Well, I would definitely say check out your resources. So we'll put the link in combination with.
Good. And I'm always happy to speak to people. As I say, I suppose I'm very enthusiastic about people incorporating it, but incorporating it in the right way at the right time. I've had lots of people that I've put off doing it, you know, where they go, well, I'm only going to get access to the machine once every 2 weeks, or I don't have a machine, but I've signed up to a PG cert. I don't have a clinical supervisor, and lots of things need to be in place before you actually make that commitment and start your learning pathway.
Right. Yeah, no, well, that's a good time to finish. So cool. Thank you very much for that. And
thanks for the chat, Andy.
No problem, always. I'll speak to you soon.
Take care. Bye.
Yeah.